As a nursing assistant, you're responsible for maintaining a neat, clean environment with each patient that you take care of. Hi, I'm Kathy Getrist, and I'm a nursing instructor in community health. Today's topic of discussion is on bed making. Bed making will be a frequent responsibility of you, the caregiver. This responsibility includes making sure the bed is both neat and clean. A properly maintained bed makes patients feel better. It also promotes comfort and helps prevent decubitus ulcers, also known as bed sores. If a person can get out of bed, it's much easier and better if that happens, and the bed can be made at that time. This is called making an unoccupied bed. There are two types of unoccupied beds. The first is a closed bed. A closed bed is made after the patient is discharged, and it's made ready for a new patient to come in. Some caregivers make closed beds every day when residents are up and about for most of the day. The second kind of unoccupied bed is called the open bed. The open bed is when the top linens have been folded back so the patient can get into bed and get covered up easily. It's sort of a welcome sign to the patient. Open beds are made for all hospitalized patients and certain nursing home residents. Linen for making beds is usually stored on a linen cart or in a clean utility room. When collecting linen for bed making, it's most efficient if the linen is arranged in the order in which it's going to be used. First, the mattress pad, flat bottom sheet or contour fitted sheet come next, plastic draw sheet or incontinence pad, cotton draw or lift sheet, top sheet, blanket, bedspread, pillowcase. And when the linens for bed making are collected, linens for personal care are also collected. These include a bath blanket, towels, washcloth, and gown or pajamas. The mattress pad will be used first, but it's at the bottom of your stack. To get it at the top, place your free arm on top of the stack of linen and turn the stack over onto your other arm. The mattress pad will now be on the top and the patient's gown will be at the bottom. There are some principles of care when dealing with linens. First, make sure that you always wash your hands before touching clean linen. Never touch clean linen with soiled gloves. Collect only the linens that you need. Extra linen that is taken into a patient room cannot be removed and used for another or returned to the linen cart. It's placed in the laundry hamper. For infection control, the clean linen cart is always covered. Replace the cover after removing linen. Hold linens away from your body and uniform. Your uniform is considered to be dirty. If the linen touches your uniform, the linen is considered to be contaminated. Do not shake linen in the air. This causes the spread of microorganisms to get into the room. Place clean linen on a clean surface. This could be a clean bedside stand, an overbed table, or a chair. Linen that touches the floor is considered dirty and must not be used, but placed in the laundry hamper. Wear gloves when removing linens that have been soiled with urine, feces, or other bodily fluids. When removing soiled linen from the bed, keep the soiled areas inside and roll the soiled linen away from you. Place dirty linens in a linen hamper or bag, never on the floor or on a clean surface in the room, such as an overbed table or chair. Fill the laundry bag no more than 2/3 full so you can close the bag easily. Lift the laundry bag and transport to a receptacle for disposal. Do not drag along the floor. making an unoccupied bed. A patient has been discharged from the facility, and the caregiver is going to make a closed bed after the room and bed have been cleaned. First, the caregiver washes her hands and collects clean linen and places them on a clean surface. She adjusts the bed to a comfortable working height for using proper body mechanics. Next, she pushes the mattress to the top of the bed, then places a mattress pad on the bed and unfolds it so it is even with the top of the mattress. To save time, the bed should be made one side at a time. The caregiver unfolds the bottom sheet so the center crease is in the middle of the bed and the bottom edge is even with the bottom of the mattress. The remaining length of the sheet reaches over the top of the mattress. The hem stitching is facing down. Hem stitching can be a source of skin irritation if it rubs on the patient's body. Next, the caregiver folds the sheet to the other side of the bed, tucks the top side of the sheet near the hem under the mattress, and makes a mitered corner. To make a mitered corner, the caregiver raises the side of the sheet onto the mattress while tucking the remaining portion under it. Then she lowers the raised part of the sheet and tucks the entire side of the sheet under the mattress. Mitered corners are not necessary if fitted sheets are used. Now the caregiver continues to tuck in the sheet, moving down the length of the mattress. A plastic draw sheet is placed on the bed next. This protects the bottom sheet and mattress pad from getting wet or soiled. It's placed 14 inches from the top of the mattress. Some facilities do not use plastic draw sheets and others use them only for certain patients. A cotton draw sheet is needed if a plastic draw sheet is used. Most facilities use cotton draw sheets, often called lifter sheets, even if they do not use plastic ones. They are very useful in helping lift patients up in bed. The cotton draw sheet must completely cover the plastic draw sheet so that the plastic does not come in contact with the patient's skin. If the cotton draw sheet has a hem, make sure it's facing away from the patient's skin. Cotton and plastic draw sheets are tucked under the mattress. You can tuck them in together or separately, whichever is more comfortable for you. Just make sure they're smooth and tight when finished. Now the caregiver goes to the other side of the bed to finish making that side. She makes the mitered corner at the top of the bed and tucks in the entire side of the bottom sheet, pulling it tight to make sure there are no wrinkles. Next, she pulls the plastic and cotton draw sheets tight so there are no wrinkles in those, and tucks them under the mattress. Now the caregiver places the top sheet even with the top of the mattress. She unfolds it lengthwise and centers the crease in the middle. The hem at the top is placed with the seam facing up and away from the patient. Extra material is folded to the center of the bed. Next, the blanket is placed on the bed so the center is in the middle of the bed. And the upper end is 6 to 8 inches from the top of the mattress. Then she folds the extra material to the center. The bedspread's next. The upper end is placed so it is even with the top of the mattress. She makes sure that the linen facing the door will be covered by the bedspread so the bed has a neat appearance. She tucks in the top sheet, blanket and bedspread at the foot of the bed. The caregiver goes to the other side of the bed and straightens and smooths the linen, moving from the head to the foot. She then tucks the linen in at the foot of the bed and makes a mitered corner on both sides. She grabs the top linens and pulls up, making toe room when the patient gets into bed. The top of the bedspread is turned under the top of the blanket to make a cuff. Then she brings the top sheet down over the bedspread. These steps are not done in some facilities, so check with your supervisor. Next, the caregiver places the pillow in the pillowcase. There are two methods that may be used. One method involves placing the pillowcase flat on the bed while grasping the zippered end of the pillow into a V shape and then guiding the V end into the pillowcase. She releases the pillow so it opens into the corners of the pillowcase. The other method involves holding the closed end of the pillowcase and gathering up the rest in her hand. Then grasp the pillow with the covered hand and pull the case over the pillow. It is never acceptable to put the pillowcase on while holding the pillow tucked under your chin. The pillowcase opening should be directed away from the door to the room. To finish the procedure, the caregiver attaches the call light, lowers the bed to its lowest position, and places personal care linens in the bedside stand. To open the bed, the caregiver grasps the linens, walks past the foot of the bed, and fan folds the top linen in thirds. When the patient gets into bed, the top linen can be pulled up easily. Finally, the caregiver leaves the room and washes her hands, folding the blanket and/or spread for reuse. A complete linen change is not usually done every day unless the linen has become very wrinkled, wet, or soiled. When the bed is changed, the mattress pad, the plastic draw sheet, the blanket, and the bedspread can be reused if it's not soiled. So collect only the items that are needed when you're gathering your linen. When removing the blanket and spread, fold them neatly so they can be put back on the bed easily. To fold a blanket or spread, loosen the top linens from the foot of the bed. Fold the top edge of the bedspread to the bottom, then fold the near side to the far. Fold the top edge to the bottom edge again 1 to 2 times. Place the spread over the back of a chair. Repeat the same steps for reusing the blanket. Of making the occupied bed. Sometimes a patient is unable to get out of the bed in order for you to change their linens. You will have to change the linen with the patient in the bed. This is called making an occupied bed. As with all procedures, the caregiver starts by washing her hands. Then she collects the necessary linens. After placing the linen on a clean surface, she explains the procedure to the patient. She provides for privacy by pulling the screen around her patient and raises the bed to a comfortable working height for using proper body mechanics. Next, the caregiver lowers the head of the bed as near to flat as is possible. She applies the glove if she suspects that the linen has been soiled with blood or any other body fluid. Then she loosens the top linens at the foot of the bed. Because the caregiver is going to reuse the blanket and bedspread, she folds them and places them over the top of a chair. Before removing the top sheet, the caregiver covers the patient with a bath blanket, which will keep her warm and provide privacy during the procedure. Then she lowers the side rail on the side nearer to her and unfolds the bath blanket over the top sheet and asks the patient to hold the bath blanket. If she's unable to do so, she would tuck the bath blanket around and under the shoulders to hold it in place. Then the caregiver grasps the top sheet under the bath blanket at the shoulders, pulling it down to the foot of the bed and removing it. It is then placed in the laundry hamper. Next, she makes sure that the mattress is at the head of the bed and positions the patient on the far side of the bed, making sure the pillow stays with her. She loosens the linen from the head to the foot of the bed. The caregiver notices blood on the draw sheet, which will need to be reported to the nurse. Starting with the cotton draw sheet, the caregiver rolls each piece of linen towards the patient's body. She removes her soiled gloves and washes her hands after raising the side rail. Next, she lowers the side rail and applies clean gloves. The mattress pad is going to be reused since it is not soiled, so she makes sure it is smooth and positioned evenly on the bed. The caregiver places clean linen on the bottom of the bed in the same manner as the unoccupied bed. This time the caregiver will use a fitted bottom sheet. She places the bottom sheet on, pulling the fitted corners over the top and bottom of the mattress. She then tucks in the side and folds the extra towards the patient underneath the soiled linen. The caregiver is going to use an incontinence pad. Sometimes it is used instead of plastic and cotton draw sheets. The incontinence pad protects the bottom linens from soil and can be used as a lifter sheet as well. The caregiver talks to the patient during the procedure, making sure she's comfortable. Then she raises the side rail and assists the patient to move to the other side of the bed over the hump of linen. She makes sure that the patient does not get tangled up in the bath blanket. She loosens the bottom linen on the other side and checks for personal items such as dentures, glasses, or rings that may have been left in the linen. She then rolls the soiled linens away from her and discards them in the laundry hamper, holding them away from her uniform. Then discards the soiled gloves and washes her hands after raising the side rail. Next, she puts down the side rail. The mattress pad is then smoothed and the fitted or contour sheet is tucked under the top and bottom corners of the mattress, making sure there are no wrinkles. The incontinence pad is smoothed over the contour sheet. The caregiver has the patient move to the center of the bed. Now she's ready to put on the clean top linens. The caregiver raises the side rail and moves to the other side. She places the top sheet over the patient, making sure the center crease of the top sheet is in the middle of the bed. The hem is even with the top of the mattress, with the hem stitching facing up and away from the patient. The caregiver asks the patient to hold onto the top sheet while removing the bath blanket and disposing of it in the laundry hamper. Next, she unfolds the blanket so the center is in the middle of the bed and the blanket covers the patient. Note that the top hem is 6 to 8 inches from the top of the mattress. Next, the caregiver puts on the bedspread, unfolding it so the center is in the middle and the patient is covered. The top hem is even with the top edge of the mattress. The top hem of the spread is turned under the blanket and the top sheet is turned over the spread. She raises the side rail and moves to the other side to finish straightening the linens. The caregiver moves to the foot of the bed and tucks in the top linens under the mattress and makes a mitered corner at the bottom. She then finishes making the other side of the bed, miters the corner, and loosens the linen for toe room. After changing the pillowcase, the caregiver attaches the call light. Then she lowers the bed to its lowest position and makes sure that the patient is comfortable. The caregiver removes the privacy screen or curtain and removes the soiled linen to the appropriate receptacle. Finally, the caregiver washes her hands.